Welcome back to GMP Scenario, presented by PharmaContentLabs.com.
In a highly regulated world like ours, sometimes the smallest shortcut can cause the biggest headache. So picture this. A simple change gets made, the paperwork is all signed off, and everyone just moves on with their day. But what if that simple little fix just silently blew up your entire quality control system? That's exactly what we're going to unpack here, why this is such a critical lesson in good manufacturing practice.
Okay, so let's set the scene. Imagine you're in quality assurance, and you're reviewing a change record, a piece of equipment, right? Its settings got tweaked a little bit and the change was implemented. On the surface, everything looks totally fine, just a routine open and shut case.
And hey, when you look at the to-do list, it looks perfect. The team went right down the checklist, The new settings are active, the SOP has been updated, and all the required staff have been trained on it. So, mission accomplished, right? Case closed.
Well, not so fast. Hiding just beneath this perfectly checked-off list is a really critical, and I mean critical, oversight. So, yeah, what's the big deal here? What's the problem?
And this is where it all comes together. You've got these two completely different viewpoints clashing. On one side, you have engineering, and they're looking at this as just a small settings tweak. They're thinking, come on, a full validation isn't necessary for this. But on the other side, you've got the rules of GMP, and they are crystal clear. It says any potential impact must be formally assessed. It's not a judgment call, it's a requirement.
So which side is right? Is it engineering's practical, on-the-ground call, or is it the official GMP rulebook? Let's get the final verdict. And the answer? Oh, it's not even a question. It is a change control failure. There's no gray area here, absolutely no room for interpretation. The process was not followed correctly, and that has some pretty serious implications. So why is it such a slam dunk failure? Well, it all boils down to this one fundamental principle. You can't just decide a change is minor. The rules demand that every single change, I don't care how small it seems, has to go through a formal assessment to figure out its impact on qualification and validation. You have to prove it's minor. You can't just assume it. Now look, this isn't just about some minor procedural hiccup. This one little oversight puts the entire integrity of the manufacturing process at risk. Why? Because it threatens something we call the validated state. So what in the world is the validated state? Think of it like this. It's your scientific guarantee for your whole process. It's all the documents, all the data that proves without a shadow of a doubt that your system is under control and can consistently pump out a quality product. It's the very foundation everything else is built on. And believe me, the stakes here are incredibly high. The second you skip that validation assessment, it's like pulling a block from the bottom of a Jenga tower. You instantly lose your documented proof of process control. You can no longer scientifically defend your product's consistency, and honestly, you're basically walking into a guaranteed failure during your next regulatory inspection. Just imagine an inspector walks in. They're looking through your logbook, they see a change, and one of the very first things they're going to ask is this: show me the validation linkage for this change. If you don't have a good answer, you're already in deep trouble.
Okay, so we've seen the problem and we know the stakes are high. So how do you make sure this never, ever happens to you? The solution is to have a disciplined validation process for every single change. Let's walk through what that checklist actually looks like.
The right way to do this really breaks down into 4 clear steps. Step 1, you've got to classify the change. Ask yourself, could this thing impact critical process parameters, like temperature or pressure, or the critical quality attributes of the final product? Step 2, then you do a risk assessment. Based on that classification, you figure out what, if anything, needs to be retested. Step 3 is pretty straightforward. You actually do the work, run the necessary qualification or revalidation tests. And finally, the all-important Step 4. You document everything, all the test evidence, all the approvals, and the formal decision to release the equipment back into service. And let me be clear, that documentation part, it is absolutely non-negotiable. You need a clear, solid, defensible paper trail. This has to include the risk assessment that explains your decisions, what triggered your validation plan, all the test results, the right approvals, and a final justification for putting the process back online. This is your proof, this is your defense. All right, let's zero in on the single most common mistake people make in this situation. There's one specific trap that trips people up over and over again, and it's the very first thing inspectors are trained to hunt for. So what is it? What's the #1 wrong move you can make in this whole scenario? The single biggest pitfall? It's this, right here. calling a change minor without any documented evidence to back that claim up. That word, minor, is a huge red flag for an inspector. The moment they see it, they are going to dig deeper. They're going to want to see the risk assessment and the data that proves it's actually minor and doesn't touch the validated state.
And that really just leaves us with one crucial question you should be asking about your own processes. Is your change control system truly inspector-proof? Think about it.
Thank you for watching. If this helped, like and subscribe. More GMP scenarios coming.